Assalamualaikum and good morning, ladies and gentlemen. My topic today is on allergic rhinitis and vitamin D deficiency. Allergic rhinitis is a type of inflammatory condition mainly affecting the nasal mucosa. It is associated with multiple comorbidities. It is a symptom disorder of the nose, include nasal obstruction, rhinorrhea, sneezing, and itchiness of the nose and eyes. These symptoms are triggered as a result of increased inflammatory mediators like histamine and leukotriene. Studies showed that 10 to 30% world's population suffers from allergic rhinitis. The symptom of allergic rhinitis can affect on school performance and work productivities. It imposes a significant burden on many people. Majority of studies showed that most of patients with asthma suffers from allergic rhinitis. And the study also showed that 30% of patients with allergic rhinitis have asthma. Allergic rhinitis is a major risk factor for poor asthmatic control. Moreover, allergic rhinitis can predispose patients to acute and chronic rhinosinusitis, otitis media, rhinoconjunctivitis, lower respiratory tract infection, dental problems like malocclusion, and sleep disorders, for example, obstructive sleep apnea. Recent research work has shown that vitamin D receptors are expressed in various immune cells, suggesting the role played by vitamin D in the immune system and diseases mediated by this system. Study also showed that vitamin D receptors have been discovered on the surface almost all of inflammatory cells. A link between allergic asthma and vitamin D levels had been reported in many epidemiological studies. This is an overview of vitamin D and its interaction with cells in the immune system. Vitamin D is produced by a combination of dietary sources and ultraviolet exposure. Vitamin D is converted into 25-hydroxy vitamin D in the liver, and then hydroxylation of 25-hydroxy vitamin D to 125-hydroxy vitamin D mainly occurs in kidney and peripheral cells. Laboratory evidence suggested that 125-hydroxy vitamin D can affect the function of immunocytes by enhancing innate defense mechanism and inhibiting inflammatory events. Therefore, the changes of vitamin D level in the body may regulate the immune system, thus can affect the occurrence of allergic rhinitis. This is a study by Zhang et al. In China, conducted to look into the association between vitamin D receptor and allergic rhinitis. The study population was 400 patients with allergic rhinitis and 400 healthy controls, a total of 800 patients. They found that vitamin D receptor gene is associated with allergic rhinitis, and a specific genotype is associated with the increased risk of allergic rhinitis in the Chinese population. Another study by Banner et al. Is conducted to look on the impact of vitamin D deficiency on asthma, allergic rhinitis, and wheezing in children. A total of 2,350 children were involved in this study. They were healthy children or children with asthma, allergic rhinitis, and wheezing. The study found that there was a strong correlation between vitamin D deficiency with asthma, allergic rhinitis, and wheezing. Al-Nori et al. Conducted a study to compare the vitamin D and immunoglobulin E level in allergic rhinitis and healthy people. a total of 100 participants involved in the study. 50 patients were allergic rhinitis patients and 50 healthy volunteers. They found that vitamin D deficiency was significantly related to the severity of allergic rhinitis symptoms. A1 et al. Also did a similar study, but their population was only allergic rhinitis patient. They looked into the association of the vitamin D and immunoglobulin level with severity of allergic rhinitis. A total of 224 allergic rhinitis patients involved in the study. 112 patients were grouped into moderate to severe allergic rhinitis, and 112 patients were grouped into mild allergic rhinitis. They found that moderate to severe allergic rhinitis, the IgE levels were significantly raised as compared to mild allergic rhinitis, and the deficiency of vitamin D is associated with increasing severity of allergic rhinitis symptoms. Study by Ma et al. Involved 1,337 participants, 655 patients with perennial allergic rhinitis, and 682 healthy controls. They found that perennial allergic rhinitis patients exhibited lower serum vitamin D levels compared to healthy people. There was no significant correlation between vitamin D deficiency and severity of allergic rhinitis. Majority of research on prevention of allergic diseases using vitamin D supplementation and its potential impacts remains unclear. However, few articles suggested that using vitamin D as an adjunct therapy for treatment of allergic rhinitis may relatively reduce the symptom of allergic rhinitis. The vitamin D chewable tablet is safe, effective, and simple treatment for patients with allergic rhinitis. However, future good quality clinical studies is needed to confirm the validity of the role of vitamin D in treating allergic rhinitis patients. We have conducted a study to look into the vitamin D level in allergic rhinitis patients and healthy control. This is a case control study involving 186 patients. 93 patients were allergic patients and 93 were healthy controls. Our aim was to measure the vitamin D level in healthy subjects and allergic rhinitis patients to compare vitamin D level across severity of allergic rhinitis patients and to determine the association between quality of life and vitamin D level in allergic rhinitis patients. The data was analyzed using non-parametric Bruce-Cavallis test and Pearson correlation analysis. P less than 0.05 was considered as statistically significant. We found that 77% of allergic rhinitis patients had vitamin D deficiency and 60% of healthy group had vitamin D deficiency. The difference between the allergic group and healthy group was statistically significant with a p-value of less than 0.05. There was no significant correlation between vitamin D level and quality of life of patient in 4 main domains of quality of life. For example, is sleep time, sleep, daytime, and practical problem. We found that the higher proportion of vitamin D deficiency among allergic rhinitis patients compared to healthy control with a p-value of less than 0.05. Our study finding is similar to other study that conducted by Jung et al. In 2013 in South Korea and also by Dogru et al. In 2015 in Turkey. There was no significant relationship between vitamin D level and severity of allergic rhinitis. Our result is similar with the result studied by Yu et al. In 2015 and Dogru et al. In 2016. There was also no significant correlation between vitamin D level and quality of life represented by 4 main domains, which are sleep time, sleep, daytime, and practical problem. In conclusion, our study found that allergic rhinitis patients may have vitamin D deficiency. Vitamin D deficiency in our study did not correlate with the severity of allergic rhinitis. And vitamin D deficiency also did not influence the quality of life of patients with allergic rhinitis. Based on our finding, measuring serum vitamin D level is recommended in patients with allergic rhinitis. Vitamin D supplement can be recommended as an adjunct treatment in allergic rhinitis patients who have deficiency of vitamin D. However, further randomized control trial is needed to further our understanding of the role of vitamin D may play in future treatment protocols. With that, I thank all of you for your kind attention.